I'm very pleased to have on our show today Dr. York Pei, who is a professor of medicine in the Division of Nephrology at the University of Toronto and a prominent researcher in polycystic kidney disease. Today, we will speak to Dr. Pei about his work in polycystic kidney disease and specifically about how his research has supported and improved the lives of patients with genetic kidney disease. Welcome, Dr. Pei.
Thank you.
The topic of your work is polycystic kidney disease. Could you take a minute to define what that means and what that condition entails?
So polycystic kidney disease is not a single disease. It's a collection of kidney diseases that are characterized by development of multiple cysts in the kidney. It really depends on the inheritance pattern and also the disease gene mutation underlying the disease. But broadly speaking, the most common form of polycystic kidney disease is what we call autosomal dominant polycystic kidney disease that probably account for 90% or more of the cases that we see and predominantly affecting the adults. By contrast, the recessive form of the disease, there's usually no family history because the parents are carrier. They do not have clinical manifestations. The affected individual tend to manifest generally either at birth or at early childhood and tend to be more severe than the dominant form of polycystic kidney disease.
So it sounds like this is a disease that can be highly related to your family. So how might someone know if they're at risk of developing polycystic kidney disease or recognizing that they might have the symptoms?
Usually, many patients who have a family history for the dominant form of the polycystic kidney disease, meaning that there's usually an affected parent. Recessive disease, generally there's no family history, but there may be some kind of distant cousin that may have it, and the disease pattern tend to be less clear cut unless you have a big family, so the dominant disease more easily recognized. The recessive disease, with the modern family being small and usually is picked up when an affected child has some clinical problem either at birth or in early childhood, and then the disease become worked up and then to link to a recessive inheritance pattern.
So what are the symptoms of this disease? What does it mean to a patient if they've been diagnosed? What could they expect?
So the dominant disease tend to affect and clinically manifest in adult life and resulting in kidney failure late in middle age. There may be other manifestation that is outside the kidney, such as brain aneurysm, which some unfortunate individual can rupture and then present at an acute emergency, like in a young age, or other manifestations such as the liver or other problems. But by and large, most patients will not have symptoms until they are well into mid-adult life in the form of kidney failure. But before then, they could have high blood pressure, they can have kidney stone, they can have bleeding from the cysts that kind of give clues to the disease. By contrast, the recessive disease typically will manifest in the more severe cases at birth because of a problem of the child having breathing problem, and they may have to be placed on a ventilator. They may have kidney failure, and typically some of them may not survive. And the milder affected individual will tend to survive into adolescence without any problem of the kidneys, and they tend to have more problem from the liver involvement.
It sounds that even though this is a kidney disease, that it can really affect other organs and other systems in your body, which would make it really important to have a way to treat. How common is this disease in the Canadian population? Do we have any idea how many people suffer from it or are diagnosed with it?
It's very difficult to assess the true prevalence of the disease, but there are some recent kind of population-wide type of genetic study, one of which we participated in recently, and looking at the genetic mutation in a general population. And it would suggest, and it's consistent with some of the earlier literature, about 1 in 1,000 births is affected with the dominant form of polycystic kidney disease. The recessive form of polycystic kidney disease will be much less common.
Wow, so that's a lot of people in the Canadian population that are at risk of developing these symptoms. This has all been so interesting, Dr. Pei. We'd really like to find out more. Can you stay with us a little bit longer and teach us some more about your work? Stay with us, everybody. We'll be back shortly for more of our interview with Dr. Pei.